Alright, getting onto the topic of urinalysis and your urinary system. So, as a general overview of your urinary system anatomy, your urinary system is made up of filters, dissolve materials from the blood, regulate electrolytes and fluid volume. It concentrates and stores waste products and reabsorbs metabolically important substances, returning them to the circulatory system. They consist of the kidneys, the ureters, the urinary bladder, and the urethra. Your kidneys filter your blood and they produce the waste substance urine, which I'm sure you're familiar with. Urine is carried from the kidneys to the urinary bladder via the ureters, and the urinary bladder stores urine until it is excreted through the urethra. So it's actually a pretty basic pathway when it comes to urination as opposed to digestion. Whoa. So your kidneys filter between 150 to 180 liters of plasma each day, meaning your plasma is filtered up to 65 times a day, which is insane. It's a very consistent process. The nephron is the basic structural unit of the kidney and is responsible for urine formation. Approximately 99% of your plasma filtrate is reabsorbed and returned into the vascular system. The remaining 1% is then excreted as urine. And the largest component of urine is urea, which is a nitrogenous waste product from the breakdown of proteins. Urine contains other nitrogenous wastes such as uric acid, which comes from your nucleic acid metabolism, and creatinine. Electrolytes, including sodium, potassium, phosphate, sulfate, calcium, magnesium, chloride, and bicarbonate. Urochrome is the pigment that makes urine yellow, and it comes from the breakdown of hemoglobin. Fun fact, if your urine is closer to clear and not nearly as yellow, it means you're drinking enough water. If your urine is very, very yellow, you're not drinking nearly enough water. Exercise, dietary intake, and pregnancy can all affect the overall volume of urine produced each day. Overproduction of urine can be a sign of certain cancers and diseases, so it's important that you pay attention to how frequently you urinate. And there's an image here that shows the basic blood filtration system with your vena cava and your aorta going to each kidney, which then filter your blood all the way, and then the waste get carried through your ureter into your bladder. It's great. Excreted out the urethra. Oh, my image is gone. But urine has a consistent group of parameters, and so it can be used as a diagnostic tool via urinalysis. The different tests can be testing the color, the odor, the pH level, which is how acidic or basic it is, the turbidity, which is how clear it is. If it's cloudier, it's more turbid. If it's less cloudy, then it's less turbid. You can test its chemical composition and its physical composition. I'm going to talk about 4 tests, including the color test, the turbidity test, the smell test, and the chemical makeup test using a chem strip. This little image is urea. So the first test is the color of urine. It can be very indicative of certain health problems. So if your urine is clear to light yellow, it means you've consumed large amounts of water, uncontrolled diabetes mellitus, or alcohol consumption. Basically just a lot of fluid in your system. Light yellow to amber is considered normal. Yellow-orange to dark green would be the consumption of carrots. Bilirubin from obstructive jaundice or antibiotics can affect the color. If it's green, it's probably from food dye, but it can also be an indicator of diuretics and bacterial infections. If it's red to red-brown, it can be evocative, of blood in your system. Consumption of beets, laxatives, anti-inflammatory drugs, anticonvulsants, hemoglobin, blood in urine, or hemolytic jaundice, which is scary. If it's brown, it's possible you've consumed rhubarb recently, or barbiturates, anemia, liver infections, it's brown to black, it's serious. Or you could have just eaten a lot of rhubarb. Antidepressants can cause this coloration, and so can melanoma, which is very concerning. So if you have very dark urine, please go to the hospital. Um, I found this gross picture of a beer bottle indicating the different shades of urine. If it's like noticeably dark yellow, that's when you should start to drink more water, and if it's reddish to brownish, you should probably go to the hospital. Talking about turbidity is just how clear or how cloudy it is. If that wasn't clear before, you can test this by putting it in front of a visual, like a grid. Here, there's a blue grid. You can see clearly through the image on the left, but on the right, you can see it's harder to see through. You can also put it in front of the page of a book to test if you can still read it. It's normal for your urine to be clear, but if it's cloudy, that means that there is quite a large amount of suspended particles, which could consist of microbes, it can consist of dead cells, crystals, pus from a possible infection, bacterial infection, or other contaminants. So if your urine smells, there could be something wrong with it. A minimal odor is normal. If it's a fruity smell, it could be indicative of diabetes mellitus. If it smells like feces, like doo-doo, it could be intestinal content leaking into the urinary tract, which would be no good. If it is very strongly smelling like ammonia, you probably just eat too much protein. If it's fishy, you might have cystitis, which is a cause for concern. And if it smells like sulfur, you probably just ate things that will produce sulfur compounds in your urine, like asparagus, broccoli, things of that nature. So you can test the chemical inclusions of urine, specifically using a chem strip, which, if you're going to use one, you would dip it in urine, or your test sample, for about a second, and you would wait and watch and see how the colors change, because it's basically a little piece of paper with special minerals on it that change colors. They change different colors based on different indicators. You would never redip the test strip. You just wave it around, hold it up in the air, or let it lay face down. You don't want the colors to run or smudge, because then it would ruin your results and you wouldn't be able to tell what exactly the composition is. And you would just compare these results to a normal range of values, which would be given to you at a test site. I think there's one in your lab manual in the urinalysis section. Here is a detailed image of a chem strip and possible outcomes. So leukocytes are the top row of the chart. Looking at the row, it ranges from a tan to gray color to dark purple. The color on the test strip matches the closest with the color option labeled negative, so you would record the results as negative. The possible results for each test are written above their corresponding color in every row. So each of these shades on the very left represent a portion, oh my gosh, I cannot speak, a portion of the chem strip for the urine that you've been testing. And there is a negative, normal to large range, and just based on the color you would try to guesstimate where exactly it would be. For instance, if you look at the pH of this urine, it's at a 5, which is a little acidic but completely normal. What's one that's high? So this, you can see with the blood, there's a large amount of blood in this urine sample because it's that dark green square on the very, very right. But everything else looks pretty normal. The protein's a little high. So it's pretty easy to read, and anytime that you'd be given a chem strip, you would probably likely have a guide in the same area. So whenever the doctors need to see more about your urine test, if they're concerned about something, maybe they're looking for particles, they will use microscopy. So they'll take a sample of the urine and put it on a microscope slide, and it will be observed under a microscope in urinalysis. This is to do a sediment study, and in order to do this, they would take a small portion of the urine sample and put it in a little vial. and then spin it in a centrifuge for a few minutes to separate the water, basically the liquid, from the particles. And the particles themselves would be crystals, cells, or foreign particles. And here is just a few examples. Oh, my image got hidden. Okay, well that's not a big deal. You can still see everything else. You can see what normal urine crystals look like, and you can see what abnormal crystals look like. They look pretty painful, pretty sharp. All the different kinds of cells that can be observed. Things like mucus, oxalate crystals, air bubbles. But this way they can get a good indicator of perhaps one of your glands is overproducing because you have leucine in your urine, or cysteine, or you're too much cholesterol. Yeah. Finally, we're going to talk about the anatomy terms with your system, starting with your kidneys. This stuff is pretty close together, so pay close attention. You can see the renal pyramid, the renal cortex, the renal calyx, the renal papilla, the renal medulla, the ureter, the renal vein, the renal artery, and the renal pelvis. Notice the word renal comes up a lot here. That should make this a little bit easier to memorize. To your right, we can see the renal corpuscles, the proximal convoluted tubule, the distal convoluted tubule, the papillary duct, the collecting duct, and the loop of Henle. Or a loop of Henle, I should say. There's multiple. You can also see the divisions of the minor calyx and the major calyx. Here's a close-up where you can see the arcuate vein, the arcuate artery, the capillary networks, the interlobular veins, interlobar vein, interlobar artery. Yeah, that's supposed to be interlobular. Well, no, they're different structures. Please excuse me. Your interlobar vein, your interlobar artery are these big ones. Right here in the middle. I don't think there's a difference. Okay. I won't use those terms on the practical. I'll just tell you that right now because that is something that I need to double check. Alright, well either way, you can see them here. The capillary networks. Accurate veins. Yeah. Here we can see more with the glomerulus and Bowman's capsules, the distal convoluted tubule again, the connecting sections, the collecting ducts, the loop of Henle again. It's just a really good up-close view. I do enjoy the loop of Henle. You can see your afferent arteriole, your efferent arteriole, the parietal epithelium, the glomerulus, the Bowman's capsule, the visceral epithelium. This is a close-up of that little baby capsule on the left. Here you can clearly see the kidneys on the outside and the ureters going all the way down, connecting to the urinary bladder at the bottom. Here's the pathway of blood. It's good to know this, but I probably won't ask about it on your practical. I probably will ask about it on the quiz, though. So you can see that it comes from your arteries into the afferent arteriole, into the glomerulus, then to the efferent arteriole, but for some reason that word is not there. The peritubular capillary network into the renal vein, and that is the blood's going through your kidneys and then back through to the rest of your system. the urine is formed from this process in the kidneys, and then that has been moved through the ureters into the urinary bladder and excreted out of your urethra. And that's all for urinalysis and the urinary anatomy.